There are different types of pregnancies. Maybe you do not know this. Sometimes you're saying you're pregnant. Another person, five people can say they are pregnant. But do you know what? These five people can have different types of pregnancies. Yes, there are nine types of pregnancies. Yes. Did you know that? Let's go. What is the first kind of pregnancy? If you have not subscribed to this channel, don't forget to please click on that notification bell, click on that subscription bell so that you won't miss out on any of our videos. Let's go to the various types of pregnancies. It's possible. There are nine types of pregnancies. Let me tell you them. The first type of pregnancy, which is the common one, if you're having 10 women in here and five of them are pregnant, yes, you can say about six have this type of pregnancy. And what is that type of pregnancy? Intrauterine pregnancy. Intrauterine. Uterine is the womb. Intra means in. So it means it is inside the womb. So pregnancies that the baby grows inside the womb, that is what they call an intrauterine pregnancy. This is the most common, this is the most safest, and this is we call normal pregnancy because the baby grows inside the womb and can expand very well and feed properly and grow very well inside the womb. Second type is called ectopic pregnancy. Yes, that's some women, you do your pregnancy test, it's positive. That's why I always tell you women, if you do your pregnancy test, the first thing you should do next is to do an ultrasound scan. Please locate where that pregnancy is. So an ectopic pregnancy means that this pregnancy is not inside the womb, it is found somewhere else, and most of the times it is found in the tubes, called tubal pregnancies. In the fallopian tube, see, it is very small, it's very tiny. How can a baby grow there? There is no way a baby can grow there. And if it is not identified early, this tube is going to burst and it's going to be catastrophic to you, the woman. And by the time they want to save you, we need just seconds to save you. Because if you're bleeding, that's internal bleeding. And if you don't reach the hospital early, you might lose your life. So if it is identified early, they can even give you medications that is going to kill this baby inside the tubes and save your tubes. But sometimes if it bursts or if it grows and it's too big, they'll have to remove that tubes. You'll be managing now with one tube. And sometimes it might even be difficult to get those tubes. I made a video on this on how you can get pregnant after an ectopic pregnancy because there is a lot. Please, women out there, once you do a pregnancy test and it shows two lines, first thing, next day, or even immediately, go to the hospital, please go and locate where that pregnancy is. It is not good. The third pregnancy is cryptic pregnancy. Have you ever heard of cryptic pregnancy? I made a video on that. On a women who are, there was a young girl who came, she was 7 months and she didn't even know she was pregnant. Even the people at home did not even know that she was pregnant. That is cryptic pregnancy. It means sometimes even the abdomen might not even show. So after this, I'm going to put the video on that. You should watch this and see. There are times that you can even be 7, 8, 9 months and you don't even know that you are pregnant. So it is some women can be anxious, some can go into depression, especially those who were not expecting to be pregnant or who did not want to get pregnant. Some might be happy, especially those who have been looking for pregnancies and don't know, and now they are pregnant. So it comes with mixed feelings. It depends on you now. So it's very important. And I made a video on that, on why it can happen that you're 9 months pregnant and you don't even know that you are pregnant. Please watch the video after this. The fourth one is prenatal pregnancy. Do you know that there are some people who can feel all the signs and symptoms of pregnancy before they are even getting pregnant? You know that this month I want to take in, then psychologically you just start feeling all the signs and symptoms of pregnancy. And of course, you have them. Your vomiting, nausea, your mood swings, your craving before you even get pregnant. That's prenatal pregnancy. The sixth one is surrogacy pregnancy, that you are carrying a pregnancy for another person. So there are two types, that's the traditional one or the gestational surrogacy. The traditional one is that you are carrying a baby that maybe you are genetically linked to that baby. For example, it could be your sister's baby you're carrying, or gestational, where you carry a baby that you have no genetic link with that baby. It's just someone who you decide to say, okay, you're ready to give your womb to carry someone's baby, especially those are people who their womb cannot support a pregnancy and they cannot get hold a pregnancy till term. So that kind of people can help another person. So there are various countries that accept that, others don't accept. So it depends on your own country. That's surrogacy pregnancy. Heterotropic pregnancy, it is very dangerous. Heterotropic pregnancy means that one pregnancy is intrauterine. Remember, we said intrauterine is when the baby is inside the womb, and ectopic is when the baby is outside. So you have two babies formed. That's like twins. One is intrauterine, one is in the tube. So you can even lead you to have a catastrophe with abortions, or or the baby, the tube ruptures. The tube can rupture there, and at the end, you have a problem. And maybe sometimes it can have what we call natural abortion, where it just dies, then flows out as blood. Sometimes you can see blood. If you're pregnant, then they see only one baby, then they start wondering. So those are some symptoms, those are some ways. But it can be identified if you go early, because even when you go and they check, they do an abdominal or an ultrasound and echography when you are pregnant, they must check the tube to see whether there is another pregnancy there. So if there is another pregnancy there, then there's one in the inside the womb. The doctor is going to decide what to do at that stage. And those are very rare cases. Those are rare conditions. Sometimes the one in the tube just dies on its own, giving way for the one in the womb to continue growing. The eighth is pregnancy of unknown location. Can you imagine me? I have seen a pregnant woman here. I've seen a pregnant woman who the baby was in the abdomen. Yes, where the intestines are found. That's another kind of ectopic pregnancy. It's called abdominal pregnancy. So there it shows that ovulation occurs and the egg is fertilized by the sperm, but it instead goes backward. Or another scenario is if the egg ovulates and it falls into the abdomen, then the sperm, of course, the tube, there's a hole at the end. So when the sperm comes, it goes out and falls in that tube and falls in the abdomen. Normally it dies, the body takes care of it. But if there's an egg there, then the sperm will go and fertilize. You see there even the placenta is inside the place where the intestines are. Wow. Seriously, I saw that. It's just that at the end, by the time they had to remove, the baby finally died. But this baby grew up right to 9 months in the abdomen. Normally, in those kind of cases, they don't touch. They leave the baby to just grow there, because you cannot go and remove, of course, and come and put in the womb. The baby grows there, then you follow up. And the last one, that's number nine. The ninth type of pregnancy that we have is pseudocysis pregnancy. That is when a woman experiences all the signs and symptoms of pregnancy, but actually she is not pregnant. I have had a lot of women coming to me with this same complaint, that they have all the signs and symptoms of pregnancy, but they are not pregnant. There is no baby. There are many things which can actually talk tell about this. I've made a video where you are pregnant but no baby. Please, after this, you can also watch it. You have a lot of videos to watch after this, so stay tuned to this channel. There is a lot to learn. There is a lot to learn. Know yourself, know how you can handle it, and share to other women out there. You cannot, of course, leave this information to yourself. You must want to help another woman that, hey, see this video which helped me. Share it to her, and don't forget, subscribe. Don't forget, give a thumbs up, and you can also ask your question. And to join our community where we talk more about, we prepare you for pregnancy, we follow you up through our pregnancy, you can click on the link on the description box and you can reach out to us. And there, those who come and consult will have a discount from us if you are part of our community. Thank you very much, and God bless you. Have a nice day.